Do you often feel like you have to pee even right after you just went? Or maybe you feel a burning, aching pain in your bladder. But every test says no infection. You might be dealing with something called Interstitial Cystitis, or IK, also known as painful bladder syndrome. In today's video, we'll talk about what it is, why it happens, and how you can manage it to live a more comfortable life. Interstitial cystitis is a chronic condition that causes pain, pressure, or discomfort in the bladder and pelvic area. It can make you feel like you need to urinate all the time, even when your bladder isn't full. Unlike a UTI, there's no bacteria causing it, which is why antibiotics don't help. Instead, the lining of the bladder wall becomes irritated or inflamed, and that sends pain signals to your brain. People with IC often describe it as a burning or pressure in the bladder, frequent urination, sometimes 30 to 40 times a day. Urgency, feeling like you can't hold it even for a minute, pain during sex, and in many cases, relief after urinating. Symptoms can come and go. You may have good days and painful flare-ups that last weeks. Doctors still don't know the exact cause, but there are a few strong theories. Bladder lining damage. The inner layer of your bladder, called the urothelium, may develop small cracks, allowing urine to irritate the tissue beneath. Autoimmune reaction. The body's immune system might mistakenly attack its own bladder cells. Nerve hypersensitivity. Some people have nerves that overreact to even normal amounts of bladder filling. Mast cell activation. Certain immune cells release histamine, which causes inflammation. Previous infections or trauma. A UTI, pelvic surgery, or even childbirth might trigger chronic bladder sensitivity later. IC is a real physical condition. There is no single test for IC. It is usually diagnosed by ruling out other problems like infection, kidney stones, or bladder cancer. Your doctor may do urine tests to check for infection, cystoscopy, using a small camera to look inside your bladder biopsy to check for inflammation, or a potassium sensitivity test to see how your bladder reacts to irritation. There's no single cure, but symptoms can be managed through a combination of treatments. 1. Lifestyle and diet changes. Avoid bladder irritants like coffee, alcohol, citrus, chocolate, tomatoes, and spicy food. Keep a bladder diary to track triggers. Try bladder training, gradually increasing the time between bathroom trips. 2. Medications. Almiron, pentosum polysulfate, helps repair the bladder lining. Amitriptyline, calms nerves and reduces pain. Antihistamines like hydroxyzine reduce inflammation. Pain relievers for flare-ups. 3. Bladder treatments. Doctors may put medication directly into your bladder. Instillation therapy, using lidocaine, heparin, or DMSO. 4. Physical therapy, especially pelvic floor therapy to relax tight muscles. 5. Advanced options, nerve stimulation, TENS unit, or even Botox injections in severe cases. Managing IC is about balance. Keep your stress low, because stress hormones can trigger bladder inflammation. Gentle exercises like yoga or walking can help. Use a heating pad during painful flares. You're not alone, and many people find relief over time with the right care plan. Interstitial cystitis may not have a cure yet, but it's manageable. With the right treatment, diet, and stress control, you can live a full, comfortable life again. If you suspect you might have IC, talk to a urologist. Early diagnosis and gentle self-care can truly change your life. Like, subscribe, and share to help more people learn about hidden health conditions. Comment below if you've experienced IC. Your story could help someone else.